For women who are doing reconstruction
Mhm.
because of having a breast cancer diagnosis, talk to me a little bit about what that process looks like. When do
Sure.
you enter into the conversation and
Sure.
the before, during, and after?
So, really, it can be variable. When a woman is diagnosed with breast cancer, it's obviously very traumatic, it's very stressful. And they're typically seen by a breast surgeon or maybe a medical oncologist first. And the oncology doctors, the surgical oncologists, as well as the medical oncologists, their goal is to treat your cancer.
Mm,
And sometimes that is their main focus and less focused on their reconstructive options.
okay.
In some centers, there's a collaboration between specialties. So you'll meet with a breast surgical oncologist as well as maybe a medical oncologist, maybe a radiation oncologist. And in that collaborative environment, oftentimes you should be invited to meet with a plastic surgeon to discuss your options.
So tell me about, like, does that happen frequently or?
Sometimes that it doesn't always happen because depending on, I guess, which surgeon you see, they're typically going to be the driver. And so I think it's important for women to be educated about their choices because I've had women come to see me for reconstruction and we start talking about different options. And breast reconstruction then becomes a very complex decision making process all of its own. In the interim, patients are typically emotionally reeling from the diagnosis of breast cancer. So it can be a lot to digest and take in. But as a plastic surgeon, I want to make sure that women are aware of their choices.
And it's covered after you've been
Yes,
diagnosed.
it is covered. There is a Women's Healthcare Act that was passed in Congress in the 1990s that covers breast reconstruction by insurance. Insurance companies, including Medicare, are mandated to cover breast reconstruction, not only in at the immediate time of diagnosis, but subsequent procedures in the future. So if there's something that needs to be revised,
Oh,
it also importantly covers surgery on the other breast, so the non-affected breast.
really?
So that
Okay.
is something that women need to understand that it is covered by insurance. And say you're having surgery on one breast and you're going to have that breast reconstructed, and say it's your right breast. Then you want, as a plastic surgeon, we want you to have the best symmetry, or we want your breast to match. So that means that the insurance companies are obligated by law to cover whatever procedure you need to have done on the left breast. And that could be anything from a breast implant to give you balance, a breast reduction, a breast lift, or in some cases, women may opt to have their non-affected, their non-diagnosed breast removed to prevent future cancer. And then you're eligible to have both breasts reconstructed.
Okay. So let's talk about when a survivor does make that choice of having the reconstruction. Is it, do they have to do it immediately? Can they
Sure.
delay it? Or, and also, can they use their own tissue?
Sure. There are lots of different choices, which makes that even more complicated conversation. So first and foremost, we want patients to understand that we want their breast cancer to be treated adequately. And that may be starting with the breast surgeon. That could be a lumpectomy or just removal of the mass itself, plus or minus radiation. Or it can mean, in order to give you the best chance of survival, a total mastectomy, meaning the entire breast is removed. Then there's also subtle nuances as we do mastectomies. Are we able to save the nipple? Are we able to save some of
Oh,
the markers, the anatomic markers that identify your breast as a breast, right? So it's not
okay.
just a lump of tissue. It's got a nipple. It has the pigmented tissue around it called an areola. It's got shape. It's got folds. It's got volume. It's got movement. And those things are things that plastic surgeons we think about on a daily basis. But your surgical oncologist, your medical oncologist may not think about that. So understanding what type of treatment for your breast cancer is appropriate then helps plastic surgeons to guide you into making the best choice for a reconstruction. Obviously, the best thing is to not get breast cancer. The second best thing is to have an early breast cancer. When you have an early breast cancer and you take care of that diagnosis, then there opportunities maybe for the oncologist to take less tissue and more opportunity for reconstruction. So you decide with the surgical and medical oncologist what's the best treatment to cure your cancer
First.
first and foremost. And that may be just simply surgery. It could be surgery and radiation. It could be chemotherapy first,
Hmm.
and it could be a combination of all of those involved.
Sure.
But to answer your question, does it have to be done at the diagnosis? It does not. You can have your breast cancer treatment and then heal from that both mentally and physically,
And that's the key word, mentally.
and then you can come back in the future and have a breast
So
reconstruction.
there's no window of time.
There's no window. There are certain benefits to having a breast reconstruction done at the same time as your cancer treatment. But I think the breast surgeons are and the plastic surgeons work together to try to give you the best outcome if it's a delayed reconstruction. And I always tell patients this: there's always the option not to do reconstruction.
Oh,
And that is a viable and important choice for women. It is about choices and for you to be educated. Breast reconstruction can be complicated. Breast reconstruction may require multiple procedures. A reconstructed breast doesn't always look or feel like your natural breast. And those are limitations that plastic surgeons are constantly working to improve. But the reality is we're not quite there yet. So my goal is to educate patients to understand a choice is sometimes to say no.
hmm.
And then you can always have the choice to come back and say yes in the future. So there's just different ways to approach how your breast is treated to deal with the cancer. And that will dictate how we as plastic surgeons help you reconstruct what's lost.